Hi, I'm Ann Peterson. Welcome to Health Perspective by Blue KC, featuring advice from experts on a variety of health topics. It's the place where you'll get the direction you need to make good health choices. Today, Dr. Kelly Logan is here to talk with us about back pain. Dr. Logan is a specialist in physical medicine and rehabilitation, and she is currently the director of Leawood Physical Medicine. Thanks for joining us today, Dr. Logan.
Thank you for having me.
About 80% of us have dealt with back pain at one time or another, myself included. When you get back pain, or let's say your back goes out suddenly, what should you do?
The first thing I would tell my patients is not to panic, that it happens quite often, and it's almost always when there's a change of routine. I see this a lot with road trips or people that are traveling. Usually, I'll have patients take 24 hours of an over-the-counter anti-inflammatory of their choice, whatever works for them. Also, ice, heat, and relative rest. You don't want to be bed-bound, and you certainly don't want to go 24 or 48 hours without moving whatsoever. If this persists for 3 to 5 days and the spasms continue and the pain becomes more intense, then I usually will have my patients either call me or come in to get further advice.
Posture, how can that affect whether or not you have back pain?
I would say in my practice, one of the top 3 recommendations I make for my patients is to really work on their posture. We are in a society right now where we sit a lot and we look forward. We have slumped in or rolled in shoulders and a neck that's very forward. And so that just is not a very good position for the upper back, the mid back, and then downstream the lower back. I'll often have patients, if they're sitting at a computer, if they're at a desk job, set an alarm or set a reminder on their email even to cue them in once per hour to straighten up their posture, roll their shoulders back, to almost as if the sternum is coming straight up, and to hold themselves in a more straight posture.
Besides good posture, what are some other practical steps that we can take to protect our backs on a daily basis?
Some of the most important things to do is not to be in one position for too long. If you're sitting or if you're standing, make sure that you change position or that you move around. Another one that I can't stress enough is proper lifting technique, especially if you're in a hurry. That's when you're going to let down your guard and you're going to lift something improperly. You always want to bend at the knee. You always want to lift from the knee and not lift from the waist. That puts way too much stress on the back, and it puts the back in a very vulnerable position. The other thing that I see a lot is overuse. If you are not accustomed to going out and doing, say, a lot of gardening or a lot of yard work, break it up into 2 days, maybe an hour or 2 on Saturday or an hour or 2 on Sunday instead of 4 or 5 hours in a row. That's just too much, and the back goes into spasm and everything starts to flare up.
You talked about being at your workstation all day and having good posture. Are there other tips that you can give us on what we should do at our workspace in order to protect our backs?
Sure. If you work for a company that offers an ergonomic evaluation, I would highly recommend having somebody come in that can give you tips on the chair, if your chair height is proper, if your desk height is proper, and if your screen is in the right position. Some nice keys just to keep in mind, or to keep the arm at 90 degrees so that it's not too low or too high. And then also to keep the screen at eye level so that you're not looking down and you're not looking up. Those are the 2 most common things that I see.
Dr. Logan, these are great tips. Thank you for your time and your great advice. So to recap, you suggest regular exercise, not sitting too long, practicing proper lifting techniques, taking a break from bending, and getting an ergonomic evaluation of your workspace. Great tips.
Thank you for having me here today, Ann.
Thanks for joining us today for Health Perspective. For more information on back pain, visit the Education Center at bluekc.com. Be sure to come back next month for tips on another health topic, and register on bluekc.com today to put yourself on the path to better health.